that, I'd like to move forward with the next bill that was posted, which is Senator Goodwin's 2317. Senator Goodwin? Yep. No.
Thank you, Senator. This bill may look familiar because this was a bill that this committee passed last year, and it passed unanimously the Senate. Unfortunately, I got stuck a little bit in the House, and so we're hoping for better results this year. Mr. Chairman, essentially, this act would prohibit cost sharing for persons 45 years or older for colorectal screening examinations, laboratory tests, and colonoscopies covered by insurance policies or plans. I just wanted to just share for a moment, when I put this bill in last year, I was in perfectly good health. This year I find myself sitting before this committee, and it has become public that I myself am battling colon cancer. Unfortunately, sadly, 160 estimated Rhode Islanders will die this year of this disease. But we all know, and I know that from hearing this bill last year, and what we know is that early screening and detection can save a number of lives. It's estimated that for every dollar spent on screening, it saves $3 to $4 in cost savings for treatment. Also, we know in many circumstances there's becoming more and more circumstances of younger people being diagnosed with colorectal cancer for whatever the reasons. I don't even think they know for sure if it's environmental or other reasons. But Mr. Chairman, this bill was very important to me last year. It's just as important, it's just a little more personal. So thank you for hearing this bill, and I look forward to its passage if it's the committee's will. Thank you. There are some far better experts on this matter, Mr. Chairman, than myself that wish to testify. So thank you very much.
Thank you. Are there any questions for Senator Goodwin?
Just comment.
Yes.
I'd like to thank Whip Goodwin for coming out and the courage and really class you've shown on this issue, and let's see if we can do some good here. Thank you.
Thank you.
So you're going to have to forgive me during this hearing in that we have several doctors who signed up on several bills, and as everybody knows, doctors don't necessarily sign and have handwriting that's easy for the rest of the world to see. And so I'm going to take my best shot at what they're, how to pronounce their names and what they actually are. The first one being Dr. Samir Shah. Oh, great. And if Dr. Alan Adrian wants to join him, okay. Okay. How about Dr. Wafik El-Deiry? Okay.
Thank you, Senator Miller. Thank you, Senator Goodwin, for introducing this bill. My name is Samir Shah. I'm a gastroenterologist at Miriam Hospital. I've been in practice here for 23 years. I'm a clinical professor of medicine at Brown and chief of GI at the Miriam Hospital. I also serve as the vice president of the American College of Gastroenterology and the president of the Digestive Disease National Coalition. I'm here because colon cancer screening is so important to me. You heard Senator Goodwin's story. Unfortunately, I'm in the position of diagnosing people with colon cancer, and each time I make the diagnosis, I'm always concerned that when I talk to them, we could have prevented it if they'd come for screening when it was due. Most colon cancer is preventable. We know that colon cancer remains the second leading cause of cancer death in the United States. We know that colon cancer started as benign polyps, and therefore if we do a colonoscopy, find the polyp, remove it, we prevent people from getting colon cancer. Sometimes people don't go for colonoscopies, which is the recommended screening for preventing colon cancer, but there are other options, and there are stool-based tests that look for blood or DNA or both. If a patient does this and it's positive, then they should go for colonoscopy. It's the colonoscopy that detects the cancer or removes the polyp. So if there's a financial barrier that prevents them from doing so, they delay, worried about whatever that cost is going to be, and then they can end up with advanced cancer. If cancer is found earlier, better prevented, it's a better way to go. It's more cost effective. So I think this bill is the right way to go. It's right for our patients. It's right for Rhode Island. We know that in Rhode Island this year, over 400 patients will be diagnosed with colon cancer, and as Senator Goodwin said, 160 will die approximately. I don't mind sending business to my colleague, an oncologist here at Dr. El-Deiry, but I'd much rather send him other stuff, and we know we can prevent colon cancer. So I hope this bill passes, and I hope we get even higher rates of screening done in Rhode Island.
Thank you, Mr. Chairman. I'm Dr. Wafik El-Deiry. I'm a medical oncologist who specializes in the care of patients with colorectal cancer. I also do research to try to discover new ways of treating it and work with the American Cancer Society as an American Cancer Society research professor. I also serve as Associate Dean at the medical school, at Brown Medical School. As my colleague mentioned, colon cancer can be prevented or even cured if detected early, but sadly, throughout the country, and Rhode Island is really not very different, not enough patients at risk receive sufficient screening for us to be able to prevent this potentially deadly disease. I, as a medical oncologist, see the patients who come to my clinic when their disease has spread, and then they're looking at being treated with chemotherapy, often for many months, sometimes indefinitely, you know, this really has a big impact on their lives and also costs a lot of money when you think that this all could have been prevented if it was discovered early. We're also seeing higher rates of colon cancer among younger people. And so, and they tend to be the individuals who might pass things off or not take them as seriously as they should. And so part of the strategy here is to reduce barriers for screening and not putting undue burden on patients who need to have the colonoscopy procedures, because this is how it is proven that this is colon cancer, you know, through the biopsies, and then the patients can have surgery and could potentially be cured. So thank you for considering this very important bill that makes sense and hopefully will help save lives in the population that's at risk of colon cancer.